Hello everyone, and welcome to HealthHorizon. Today, we're diving into a crucial topic, one that could literally save your life. We're talking about the early signs of blood cancer. This often silent threat impacts thousands every year, and while many cases go undetected until it's too late, what if we could catch it sooner? Recent studies show that blood cancer rates have been steadily rising worldwide, making awareness more important than ever. The good news? Recognizing the warning signs early could make all the difference. So, ask, are you aware of the symptoms that could indicate something serious? Persistent fatigue, unexplained weight loss, or even lingering fevers might be the signals your body is trying to send. But that's just the beginning. Join us as we explore some lesser-known symptoms of blood cancer, supported by cutting-edge research. Whether you're watching for yourself, for a loved one, or simply to stay informed, this is a conversation you won't want to miss. Subscribe now and take a step toward better health. Let's embark on this journey together, because knowledge truly is power, and early detection saves lives. Please note, this video is meant for informational purposes only and should not be a substitute for professional medical advice. Always consult with your healthcare provider if you have any concerns. Now, let's begin by looking at the first early sign you should be aware of. 1. Swollen, painless lymph nodes in the neck, armpits, or groin. Swollen lymph nodes, particularly when they're painless, are a key symptom that could raise concerns about blood cancer. These swellings, often appearing in the neck, armpits, or groin, are frequently linked to blood cancers like lymphoma and leukemia, which affect the immune system. So, why does this happen? Lymph nodes are critical components of your immune system, filtering out harmful substances. When cancerous cells accumulate in these nodes, they can cause swelling, even without the usual pain. Research published in Clinical and Experimental Hematopathology 2018 emphasized that swollen, painless lymph nodes, especially if they persist for weeks without signs of infection, should be evaluated by a doctor. Now, it's important to understand that swollen lymph nodes don't automatically mean cancer. They can also swell in response to infections or other benign conditions. However, if you notice swelling that doesn't go away, it's important to consult a healthcare professional. Early detection plays a pivotal role in managing blood cancers effectively. 2. Shortness of breath. Typically associate shortness of breath with asthma or heart problems. But did you know it could also be an early warning sign of blood cancer? Blood cancers can disrupt the body's ability to produce healthy blood cells. This disruption often leads to anemia, a condition where your body doesn't have enough red blood cells to carry oxygen. As a result, individuals with blood cancer may struggle with shortness of breath, especially during physical activity or even at rest. A study published in BMC Cancer 2003 found that 44% of blood cancer patients reported respiratory symptoms, including shortness of breath, at the time of diagnosis. This finding challenges previous assumptions that respiratory symptoms weren't common in blood cancer cases. So, what causes this? Apart from anemia, blood cancers can cause the spleen to enlarge, which presses against the lungs, limiting their ability to expand fully and impairing breathing. In some cases, blood cancers can infiltrate the lungs directly, making it even harder to breathe. While shortness of breath can be caused by many things, it's essential to keep an eye on any persistent symptoms. If shortness of breath becomes an ongoing issue, especially in combination with other symptoms, it's time to consult your doctor for a deeper evaluation. 3. Persistent weakness and fatigue. While persistent weakness and fatigue may not always ring alarm bells, they can be significant early indicators of blood cancer. Here's why. Blood cancer disrupts the body's ability to produce and regulate blood cells. This can lead to anemia, a condition where there aren't enough healthy red blood cells to efficiently transport oxygen throughout the body. Without sufficient oxygen, circulation, fatigue, and weakness often follow. But this isn't just your average tiredness. Patients describe it as a profound exhaustion that doesn't get better with rest. making even the simplest tasks feel insurmountable. According to a 2023 study in Scientific Reports, up to 40% of blood cancer patients report severe fatigue at the time of diagnosis. Remember, these symptoms are nonspecific and could be related to many other conditions. But if they persist and seem unexplained, they warrant a closer look by a healthcare professional. If you find yourself constantly drained without any clear cause, don't just brush it off. Talk to a doctor and get the evaluation you need. 4. Night sweats. Night sweats. The uncomfortable episodes where you wake up drenched in sweat can be more than just a nuisance. In some cases, they serve as a warning sign that something deeper might be happening, like blood cancer. You may be wondering, how is this connected? Blood cancers, such as leukemia and lymphoma, can interfere with the body's ability to regulate temperature. This disruption often occurs because the cancer cells affect the immune system and other bodily functions. A study published in the European Journal of Hematology 2023 found that night sweats were frequently reported as one of the first symptoms in lymphoma patients. So, how can you tell the difference between night sweats caused by a warm room or spicy food and those related to blood cancer? It comes down to persistence and intensity. Blood cancer-related night sweats are more severe and occur regularly. You might experience intense sweating, soaking your nightwear and sheets, something that's not just about feeling a little warm. It's important to remember that night sweats alone don't confirm blood cancer, but they are a significant piece of the puzzle. If you're dealing with this symptom, combined with others, it's time to consult a healthcare professional. A thorough evaluation can help rule out serious conditions and offer clarity. 5. Loss of appetite or nausea. Loss of appetite or nausea might seem like minor issues, but in the context of blood cancer, they are critical symptoms to pay attention to. These signs can easily be overlooked because they are also linked to many less severe conditions. However, in blood cancer, they play a vital role in alerting you to potential underlying problems. Blood cancers like leukemia, lymphoma, and myeloma can significantly disrupt how your body processes and absorbs nutrients. This often leads to a reduced appetite. A 2019 study in intestinal research found that metabolic changes in blood cancer patients can cause a decrease in food intake, contributing to weight loss and poor nutrition. Nausea, another common symptom, can be caused by the accumulation of waste products in the body due to impaired blood cell function. Research published in BMC Cancer 2023 showed a clear correlation between waste accumulation and nausea in blood cancer patients. While these symptoms might seem insignificant on their own, they could indicate something more serious. If you're experiencing unexplained loss of appetite or persistent nausea, it's essential to seek medical advice. Don't dismiss them as just another minor issue. Early detection is crucial in managing blood cancers effectively. 6. Itchy skin. Itchy skin or persistent itching is often dismissed as a minor annoyance. But did you know that in some cases, it could be an early warning sign of blood cancer? Blood cancers like lymphoma and leukemia are not commonly associated with itchy skin, but this connection is important to recognize. So, why does this happen? In certain types of blood cancer, abnormal cells accumulate and release substances that can irritate the skin. According to a 2019 study in dermatologic therapy, nearly 30% of patients with Hodgkin lymphoma reported experiencing persistent itching. But this is no ordinary itch. It's often more intense and doesn't respond to regular lotions or antihistamines. What makes this even more concerning is that this itching often occurs alongside other symptoms like unexplained weight loss, fatigue, or night sweats. It's the combination of these symptoms that should raise a red flag. While itchy skin alone is not usually a cause for alarm, if the itching persists and is accompanied by other unexplained symptoms, it's time to consult a healthcare professional. Early detection of blood cancer can significantly improve outcomes. 7. Unexplained rash, bruising, or bleeding. Unexplained rashes, bruising, or bleeding might seem like minor issues, but they can be early signs of something more serious, such as blood cancer. These symptoms are often linked to how blood cancers, including leukemia, lymphoma, and multiple myeloma, affect the bone marrow, where blood cells are produced. When blood cancer develops, the bone marrow becomes impaired and cannot produce enough healthy blood cells, including platelets, which are vital for blood clotting. A reduction in platelets can lead to easy bruising and bleeding, often without any obvious cause. Furthermore, certain types of blood cancers can provoke an immune response, leading to skin rashes as cancerous cells interfere with normal immune function. A 2023 study published in BMC Cancer highlighted a significant correlation between unexplained bruising, rashes, and early stages of blood cancers. While these symptoms alone don't necessarily mean cancer, they're persistent or unexplained, it's crucial to seek a medical evaluation. Early detection is key, and it's always better to err on the side of caution. 8. Fever or chills. Fever or chills are commonly overlooked symptoms, yet they can be significant indicators of blood cancer. This connection was highlighted in a 2020 study published in Curious. Blood cancers like leukemia or lymphoma can compromise the function of blood cells, weakening the immune system. When the immune system is weakened, even minor infections can trigger fever or chills. Research from Infections in Hematology 2014 reveals that approximately 90% of leukemia patients experience fever as one of the first symptoms. This is not coincidental. Blood cancers directly affect the bone marrow, where blood cells are produced. As cancerous cells multiply, they crowd out healthy cells, weakening the body's immune response. This makes patients more vulnerable to infections, which often present as fever or chills. It's important to understand that fever or chills alone do not confirm blood cancer. However, when these symptoms persist or occur alongside other red flags, it's advisable to consult a healthcare professional. Early detection is the best way to manage blood cancers effectively, and paying attention to these symptoms can make a significant difference. 9. Frequent infections. Let's talk about something that often goes unnoticed: frequent infections. While we all get sick now and then, if you find yourself getting sick more often or experiencing unusually severe or lingering infections, it might be a sign of something more serious, like blood cancer. Blood cancers such as leukemia or lymphoma can weaken your immune system, making your body more susceptible to infections. A 2021 study published in Hematologica found that individuals with chronic lymphocytic leukemia can frequently experience more infections. This happens because cancerous cells crowd out healthy white blood cells, which are essential for fighting off infections. Similarly, research in Annals of Medicine and Surgery 2023 showed that frequent infections are a common early symptom of acute myeloid leukemia (AML), as the rapid growth of abnormal cells in the bone marrow prevents the production of healthy immune cells. It's important to note that it's not just the frequency of infections that should concern you, but also their severity and persistence. If you're noticing an increase in infections, or if they seem to linger longer than usual, it's worth discussing with a healthcare professional. While frequent infections alone don't confirm blood cancer, they can be a significant warning sign, especially when paired with other symptoms like fatigue, unexplained weight loss, or night sweats. 10. Coughing or chest pain. Understanding the early signs of blood cancer is crucial, and interestingly, symptoms like coughing or chest pain can sometimes be linked to this serious condition. When we think of blood cancers like leukemia, lymphoma, or myeloma, we often associate them with symptoms directly related to blood, like anemia or bleeding. But the reality is much more complex. Coughing and chest pain in the context of blood cancer usually arise due to indirect effects. For instance, a study published in Pediatric Surgery 2012 found that certain types of blood cancers can cause enlarged lymph nodes. When these swollen lymph nodes press against the lungs or airways, they can trigger coughing or even chest pain. This is not the typical cough you might get from a cold or physical strain. It's persistent and doesn't seem to have a clear cause. Additionally, blood cancers can weaken the immune system, which makes infections more likely. These infections can also lead to persistent coughing. A 2022 article in the International Journal of Molecular Sciences highlights how weakened immunity in blood cancer patients increases their susceptibility to infections, which can lead to symptoms like a chronic cough. It's important to remember that these symptoms alone don't confirm blood cancer. Many conditions can cause coughing and chest pain. However, if these symptoms are persistent, unusual, and come with other signs like fatigue, unexplained weight loss, or night sweats, it's wise to consult a healthcare professional. Early detection is critical in managing blood cancers effectively. As we wrap up today's video, we hope you've gained valuable insights into recognizing the early warning signs of blood cancer. Awareness is the first step toward early detection, and early detection can make all the difference. If you found this information helpful, don't forget to subscribe to HealthHorizon and share this video with your loved ones. Your support allows us to continue spreading awareness and empowering more people with life-saving knowledge. Stay tuned for more upcoming content on health, wellness, and the latest advancements in medical research. Together, we can take charge of our health and build a future of informed, proactive well-being. Thank you for watching, and remember, keep learning, stay vigilant, and take care of yourself and those around you. Until next time, stay healthy, stay strong.